third most common cause of death in America is likely a total mystery to you, but it claimed the lives of over 250,000 loved ones last year. Respiratory disease, stroke, Alzheimer's, these afflictions receive a lot more press, but they all pale in comparison to this concealed killer. Heart disease and cancer are the first and second ranking causes of death in the United States, but it is behind a veil of secrecy that medical error collected a death toll of more than 250,000 last year. It seems outlandish, but the Center for Disease Control and Prevention, or the CDC, does not use medical error as a recorded cause of death, instead using the underlying causes for treatment in its reports. Although a Johns Hopkins medical research team has found it to be one of the leading causes of death in America. These reports are what influence grants, research, and even the national perception of threats to livelihood. But still, medical error is completely omitted from the public eye. The effects of the neglect are clear. The masses must be made aware of the issue in order for it to be addressed, funded, and researched, as well as improving the accountability and prevention of medical errors. The most significant takeaway is that this death toll is a result of preventable harm. These are accidents causing expiration in addition to bodily harm, and it is absolutely necessary to take these problems head on. The first step is to change the way the CDC reports causes of death and to include medical error as a cause rather than the reason for the patient's visit. This easy and comparable fast fix will immediately shine a light on the issue, revealing the problem for its full magnitude when the next annual common cause of death report is released. No other action can be more important, as it will set off a chain reaction, quickly expediting the addressing of the problem. The second step involves creating protocols, improved education, and consequences following a medical error. According to the study by Johns Hopkins Medicine, the addition of medical errors to death certificates and annual reports must be done immediately. Altering the Center for Disease Control report to be more inclusive will undoubtedly have a domino effect. Once identified as such a large-scale issue, public awareness is realized, quickly followed by outcry. In turn, funding, research, grants, and more will result from the fallout. Unlike other afflictions, however, this one will quickly be curbed simply by identifying it exists in its current magnitude. The sad truth is that there will be flagrant blame toward medical professionals. But rather than place the blame, it is better to work to improve upon the situation. Currently, non-doctoral staff work long hours under difficult circumstances and are underpaid for saving the lives of people every single day. With increasing demands for nursing positions across the country and not enough to fill them, the education process is fast-tracked and much is left to on-the-job training. With the many pressures of 12 to 16-hour shifts, ever-growing patient loads, and small windows of time to get things accomplished, there's no wonder that mistakes are made. Mistakes cost a lot of money. However, according to the study by the Department of Health and Human Services, non-fatal medical errors cost more than $4.4 billion in Medicare patients alone. So it is not a mystery why they are so underreported. In fact, the same report states that less than 14% of all medical errors are even reported. More strict guidelines for self-reporting and greater consequences for hiding mistakes are necessary. both to accurately record cause of death, but also to re-educate and avoid repeating the same mistakes. Asking that more of these be reported does not get to the root of the problem. However, better education as well as training would go a long way. More education also leads to higher pay rate, which also attracts better quality nurses, in turn needing fewer errors. Medical errors have been a silent killer for years, but now is the time to address the issue, raise awareness, and save hundreds of thousands of lives a year. You are now aware of one of the leading causes of death, and are armed with the tools to change the statistics and possibly save one of your loved ones from a preventable mistake.